Pathogen that I will be discussing today is hepatitis B. First, I will be discussing the background and relevance. Hepatitis B is a vaccine-preventable infection caused by hepatitis B virus. Here is a little picture of hepatitis B virus's structure. So on the inside is the DNA polymerase, and then the DNA. Then it's followed by its core antigen, and then its E antigen, and then on the outside is its surface antigens. Barrett Bloomberg and his colleagues were the first to discover hepatitis B virus in 1967. They developed the blood tests that were used to detect the virus. Barrett Bloomberg discovered an enigmatic serum protein named Australia antigen, and then from there, they were able to invent the first hepatitis B vaccine in 1969, so 2 years later. Hepatitis B is a small DNA virus that replicates through an RNA intermediate and can integrate into the host genome. It is a prototype virus of the Hepatodinivirdae family. It's got a spherical double-shelled structure, 42 nanometers in diameter. It is a virus that contains a lipid envelope containing HBsAg that surrounds the inner nucleocapsid, and it is a virus that has virtually encoded polymerase. Next, for hepatitis B's metabolism, hepatitis B has a dysregulated metabolism on host cells, including lipid, glucose, amino acid, vitamins, bile acids, as well as nucleic acid metabolism. Hepatitis B is stable at different temperatures by incubation of cell culture-derived HBV particles. These temperature environments include 4 degrees, 21 degrees, and 37 degrees Celsius for up to 28 days, and the hepatitis B virus can survive outside of the body for at least 7 days, so up to a week. The Australia antigen, now called hepatitis B surface antigen, was first described in 1965. Identification of serologic markers for HBV infection followed this discovery and helped clarify the natural history of the disease. Next, we will be talking about the clinical symptoms, signs and symptoms of the hepatitis B virus: abdominal pain, dark urine, joint pain, fever, loss of appetite, nausea and vomiting, and weakness and fatigue are some of those clinical manifestations. The progression of the disease: later signs of hepatitis B are jaundice, so yellowing of the skin and the whites of the eyes can show up, and hepatitis B can progress to cirrhosis or liver cancer. Genetics, pathogenic mechanisms. Hepatitis B virus enters the liver cell and is transported to the liver cell's nucleus. Inside of the nucleus, the viral DNA is transformed into a closed circular DNA. This serves as a template for viral replication. The hepatitis B virus then invades and damages liver cells, which causes and leads to scarring as well as inflammation of the liver. There are different diagnostic procedures done for hepatitis B virus. So the CDC recommends the use of a triple panel test. This includes hepatitis B surface antigen, antibody to hepatitis B surface antigen, as well as total antibody to hepatitis B core antigen. And there is a diagnosis by blood test, liver ultrasound, and liver biopsy. Next, we will be talking about the impacts on health. Individuals at risk for hepatitis B virus are individuals having unprotected sex with an infected person, individuals sharing unsterilized utensils with an infected person, individuals traveling to areas with a high risk of hepatitis B infection, and individuals injecting drugs. Transmission mechanisms, it's spread from infected individual to non-infected individual through semen, blood, bodily fluids, and this can happen through sexual contact, sharing needles, and drug injection equipment. Vaccines are the best method of prevention. Vaccines are available to all age groups, although it is not recommended to infants. There's a series of 3 shots that prevent severe liver disease caused by the hepatitis B virus. Here's a little infographic. Hepatitis B vaccine protects against liver infection, and it's available in standalone or combination formulation. Different human behaviors to prevent the disease: do not inject drugs, and if you do inject drugs, never share needles and look into treatment programs. All adults should be tested at least once for hepatitis B virus. This is what the CDC says. Hepatitis B infection can cause liver cancer and early death. Most people with the virus don't know that they have it and are asymptomatic. Different antiviral medications are entecavir, tenofovir, and adifovir. There are also interferon injections, as well as liver transplants if the liver is severely damaged. Current case numbers are different U.S. versus globally. So according to the World Health Organization, 296 million people worldwide are living with hepatitis B virus. The global burden of hepatitis B is highest in the Southeast Asia regions, African regions, and Western Pacific regions. In the U.S., the prevalence of hepatitis B virus is higher in foreign-born individuals, especially those of non-Hispanic Asian origin. And the prevalence in the United States for hepatitis B chronically is 2.2 million. This comes with economic burden, so the estimated annual direct, non-medical, and indirect costs for the stages of diseases per patient with chronic hepatitis B infection were $1,564 to $4,079 for each patient. This just causes significant economic burdens on the patients and their families, and indirect costs come from loss of income due to the illness and its progression. And here are my references listed. Thank you.